of those plans have not been updated to address our state's current pandemic conditions. While we understand the decision to allow colleges and universities to each develop their own reopening plans, they showed too many common shortcomings with regard to personal health and safety, as well as student academic success and mental health support. The most important issue for us, as for everyone, is preventing the spread of COVID-19. But it is disturbing to us that only 11% of these institutions have created plans for additional support for students if they are required to quarantine or if their professors are. We want to reopen our campuses, but more importantly, we want them to remain open in the long term. Therefore, after reviewing the latest information available and after serious deliberation, we now call on the Governor, the Commissioner of Education, the Chair of the Board of Governors, and the Chancellor of the college system to issue directives similar to the ones they issued mid-semester in March to move all of Florida's institutions of higher education to remote learning for the fall semester. It is now my honor to introduce the Vice President of the Florida Education Association, Andrew Sparr. Andrew?
Thank you, Karen. I appreciate it. And good afternoon, everyone. I want to start by talking about COVID in general, right? We have uncontrolled growth of COVID here in the state of Florida. We're seeing increasing numbers. Not only are we seeing increasing numbers, we're seeing that those increasing numbers tend to be with younger people in the state of Florida, those who would typically be on our college campuses. Now, if you think back to when you went to school at the college level or any of our higher education institutions, college is not just about the academics, while that is the main reason. It's also about the college life. When you are an 18, 19-year-old, 20-year-old going off to college, you want to experience college life. And very often that means gatherings. And we know that those gatherings are set up in such a way that we would have widespread COVID-19 situations. And so when we urge the Board of Trustees, when we urge the Board of Governors and the Commissioner of Education and the Chancellor of the college system to really look at what's happening here in our state, it's because we have an obligation, a moral obligation, to make sure that our students are safe, that every person who enters the college and university campuses in this state are safe, our students, our faculty, and our staff. And that's really what's at stake here. So I'm going to next introduce Jafar Hameed, who is the Vice President of the United Faculty of Florida. He's also on the math faculty at Florida Gulf Coast University. Jafar?
Thank you, Andrew. Thanks again for joining our press conference today. Looking at the data, looking at the spread of the COVID-19 virus and the growth, especially in Florida, if we are a nation, we will be number 4 in the world. Floridians are getting infected every 10 seconds or less, and Floridians are dying every 10 minutes or less. Looking at our medical resources, many healthcare facilities are at near capacity, and only about 14% ICU beds are available. So it is high. We need to do everything we can to contain the virus, flatten the curve. Opening in colleges and universities at this time can only make things worse, and it is a step in the wrong direction. Higher ed in Florida, especially SUS and colleges, serve more than 1 million students. And if you open them now, we risk deaths, not a few, not 10, not 100, we risk deaths of 2,000 students. Let me emphasize, deaths of 2,000 of our own students, and hospitalization of 52,000 students. And again, let me emphasize, hospitalization of 52,000 students. On top of that, we risk deaths of 3,000 faculty and staff and hospitalization of 12,000 faculty and staff. So we just want to ask everyone, when you see these data, when you see these statistics, please know that these are not numbers. They are human beings. Sons, daughters, mothers, fathers, and loved ones of many, and in some cases, lone breadwinners of their family. And again, these data and stats are based on cities' population density. As you all know, colleges and universities are close quarter environments, and the density is much higher. So therefore, this can get only worse. So we all know 10 to 20 classrooms in building with hundreds of students, and they all have to pass through 1 or 2 entrances, and the hallways are about 6 to 8 feet long. So all it takes is a couple of hard sneezes here and there, and that's a disaster waiting to happen. And we are already getting emails from the concerned and scared students. And universities and colleges have wonderful plans, but those are inadequate. And this is not the time to experiment. And we need to learn lessons from other countries who opened early and are dealing with consequences. These kids are our future. They are the movers and shakers of the next generation, and we cannot experiment with them. So once again, we strongly and humbly urge our governor and state officials to do the right thing, to issue directives, just like our president said, just like they did in March, to transition to remote learning to protect the well-being of our Floridians and the Florida's economy. So with that, I'll stop it right here, and I'll introduce our next speaker. Paul Ortiz. He's a professor of history and the president of UFF at UF. Paul.
Thank you, Jafar. Imagine a state that forces faculty and staff to choose between their lives and their livelihoods. Imagine neighborhoods and communities surrounding colleges that are terrified at the health impacts of campus reopenings, where students will not even be required to be tested for COVID-19. The town I live in, Gainesville, population of 130,000, faces the prospect of the reopening of the University of Florida, current enrollment 52,000. It is ludicrous to think that we can return safely to work under the current guidelines set by the state during a time when COVID-19 infection rates are spiking all over the state of Florida. Higher education staff and faculty in Florida love our work. We pursue education careers not to get rich, but to serve a higher purpose in life. Working as scientists, anthropologists, nurses, counselors, and many other fields, we strive to teach our students to understand and to improve society, as well as to promote healthy and more meaningful lives. In order for us to reopen safely, the state of Florida must listen more to scientists and health experts and less to politicians. The concerns of local communities and the voices of all workers on our campuses must be paramount in this process. Furthermore, we must think of safety holistically, because this is the age of the Black Lives Matter democracy movement. It is infuriating in the age of the global pandemic to see so much racism in higher education directed against Chinese and Asian American colleagues. In order for us to reopen safely, we must pledge to make our campuses and our state welcoming to Asian Americans, African Americans, and international students especially. This means demilitarizing our campus police forces, and it means ending the practices of racial profiling that too many of our students and faculty continue to experience. A safe reopening means safety for all, including faculty, staff, custodians, maintenance, and service workers who make it possible for all of us to do our jobs. Thank you, and our next speaker is Marcus Milani. He is an undergraduate student at the University of Florida.
Thank you, Dr. Ortiz. As he mentioned, my name is Marcus Milani, and I am a junior at the University of Florida, and I'm also a long-time resident of Gainesville. I am horrified that UF is considering reopening. If the administration carries out this reckless plan, they will be endangering the lives of immunocompromised and vulnerable students. Additionally, following the current trends of COVID-19 cases, college-aged individuals are the most likely to catch and spread the disease. Gainesville is a city in which thousands of workers will have to come into continuous contact with UF students. So the administration's plan to reopen is deadly, not only to students, but also to those who operate the dining halls, restaurants, grocery stores within our community. Sadly, with the way the University of Florida is approaching reopening, their planning reminds me more of a hedge fund trying to salvage its loss in profits rather than an institution dedicated to education and research. UF is ignoring the science. I implore the administration to close the campus for the fall semester while guaranteeing pay, health benefits, and paid sick leave to all of its workers, non-instructional staff included. Our next speaker is Deborah Ferrari, nursing faculty at State College of Jacksonville.
Hello, I've been a nurse for 32 years, working 15 years with open heart surgery patients and myocardial infarction patients, which means I've dealt with some of the sickest patients ever. I've had my critical care certification for 27 years, and I've had my master's degree in nursing education for the last 12 years where I've taught at a state college. As a nurse, I have the ethical responsibility of non-maleficence, which means to do no harm. By returning to brick and mortar, I feel that I would be exposing students and coworkers to COVID. Our classrooms are small. Students are not able to socially distance since our classroom size is a max of 34. One concern that I have is that some of our nursing students already work in the medical field, and in order to get to class on time, may leave work and go straight to the classroom, exposing fellow classmates and faculty members. The clinicals for our college have been canceled and at hospitals due to COVID, since there is not enough PPE for working nurses, much less for our working students. So all of our clinicals have been done virtually 100%, and will continue to be virtually until a meeting on September 9th when we meet with the National Council on the State Board of Nursing. As a nurse, an educator, and a grad student, I am all three. I am fearful of going back into the classroom. I fear for my students. I fear for my coworkers and my relatives who are elderly and immunocompromised. Until our leaders are willing to listen to science and act responsibly and show some guidance during a pandemic, I am not comfortable going back. Our next speaker is Mattheweckel, a teaching assistant at the University of South Florida and grievance chair of Graduate Assistants United.
Thank you. I'm here today to attest to some of the specific challenges faced by graduate assistants in the pandemic. Graduate assistants are some of the most financially precarious people in our higher education institutions. Under normal circumstances, we travel across the country or the globe and struggle to eat and pay rent on our meager subsistence wages. Basic healthcare is often wholly inadequate if it is available to us at all. Our lives are so fragile that a mundane car repair can be a cataclysmic life event. We must acknowledge that the lives of graduate assistants are especially vulnerable to the violence of the pandemic. The state coercing us to return to work risks not only our health, but our academic and professional futures. Speaking personally, though my situation is not at all unique, the enhanced risks associated with being on campus and contracting COVID are stark. The medical costs associated with treatment can often and easily run past thousands of dollars. Saddled with such debt, I would have to drop out of school and move home. Additionally, I have no close relations in Florida who could care for me during such an illness and quarantine. As such, if I get sick, I may have to consider traveling to my family with the disease or have them risk traveling here as I recover. I fail to see how such outcomes benefit my students, my profession, my institution, or the public. Graduate assistants are an especially poor, fragile, and isolated demographic of educators. We call upon the state to recognize and consider the special risks graduate assistants face when returning to work under such circumstances. These risks are not necessary ones, but our lives are at stake, not only in terms of our professional futures, but our very existence. Our next speaker is Felicia Reynolds, an adjunct faculty member and union leader at Miami-Dade College.
Can you hear me? My name is Felicia Reynolds. Can you hear me? Yes,
Yeah.
you're good.
Okay, good. My name is Felicia Reynolds. I am from Miami-Dade College, North Campus, SEIU Faculty Forward. We are calling on Governor DeSantis to recognize the COVID-19 crisis and to allow institution of higher education to go online to its entirety for the fall semester. And now is the time for us to speak up for the safety of local communities by ensuring that all frontline employees, including adjunct professors, are protected and valued. With the current issues of livable wages, family health care benefits, and access to affordable childcare, we must take the opportunity not only to recover from the COVID-19 crisis, but to reset the cost of investment in higher education as a whole. I thank you very much. And I am introducing Dr. Andre Poole, President of UFF, Florida Atlantis University.
As president of the FAU chapter of the United Faculty of Florida, my biggest concerns are the safety of our faculty, our students, and staff. UFF FAU is a strong advocate and a strong voice for the health and safety of our university community. We understand that the university administration desires to reopen the university in the fall, but the position of UFF FAU is that we should be fully remote. We should be fully remote in the fall term and return to campus in the spring of 2021 if the pandemic is under control. We did not reach this decision lightly, but we took into consideration recent COVID-19 death spikes, an increase in the amount of ICU bed hospitalizations, an increase also in the death rates throughout South Florida, where FAU is based. FAU is a diverse campus. 50% of the student body is made up of students of color. And as an African-American male, I know firsthand, talking to other people of color, how we feel, who feel, and I have to make this clear, we feel that politicians and corporations are rushing to reopen at our expense. Blacks and Latinos are at greater risk and represent a large number of confirmed cases, with more Blacks dying at a higher rate. COVID-19 is a deadly virus that has killed more people of color under age 65 across this country. What is my life worth? And what is the life worth of one of my students of color? The mental and emotional stress is growing among the university community, and folks are hesitant to return to campus. I understand that there are economic concerns for the university and surrounding communities, but politics is at play here in so many ways, from Tallahassee, local governments who care more about political polls and making money than putting human life first. It is wrong for our officials to play a game of Russian roulette with our lives. We must not open back up at the expense of the health and safety of our FAU community, our faculty, and our students, and our staff. And it is for these reasons, universities should continue to be remote in the fall.
Thank you, DeAndre, and thank you, everyone. I hope the members of the press and our members who are joining us online today heard very clearly that we are speaking with one united voice, that we don't believe it is safe to return to our campus in the fall. And we've given you some of the reasons, and we would now like to take questions from the press. Candy, are you taking them out of the chat and making them live, or are you just reading them?
Marshall and Lauren are going to direct the Q&A right now.
Thank you.
I'm going to take the ones that we had previously submitted, and then I'll try to recognize the hands, and Lauren is going to monitor the chat. Here are the first questions we had. How long are you calling on colleges and universities to do the remote learning?
So I'll take that one. We're asking for the fall semester for right now. And part of that is because we don't believe that the public health situation on the ground is possible to be improved enough to open by the end of August or the beginning of September. And staying closed at least gives some continuity to our students, to our instructors, to our faculty and staff. We saw the wrench that it was in the spring to close things down mid-semester. And we don't want to do that to the students again. We don't want to do that to the faculty again. We want everybody to know what the semester is going to look like for the entire semester. And we think if we open it up, we know we're going to have cases. And we do not want the confined spaces that are our campuses to become super spreader sites in our communities. And so we're asking for reprieve for the fall, so that everybody's on the same page, everybody knows what to expect for the entire semester, and we can get on with our students' academic progress.
Okay, that question was from Lori Davison of Bay News 9. And Lori, if you have the other two questions, I think were answered, but if you want to ask them again, you can raise your hand or put it on chat. Next question is from Isaac Morgan at Florida Phoenix. It is, will UFF FEA join the lawsuit against the state for reopening schools?
Isaac, at this time, the way my understanding of that lawsuit is that it is pertaining to a particular section in the Florida Constitution about the public school system. And so that section would probably be a stretch to apply to universities. Now, that's not to say there aren't other things in there that we might look at and go to and challenge. But right now, we don't have a lawsuit ready to present on behalf of higher ed.
Okay, I don't have any more that were pre-issued. I'm trying to check the chat. Do you see any, Lauren, in the chat? And I'll check the hand.
If you go to the participants page, click Joe McLean and Anna Cevallos. Raise their hand.
Hi there.
Are we going to put them on live to ask? Or you?
Go ahead, Joe.
Okay.
Hi there, I'm Joe McLean. I'm with WJXT News for Jacksonville. I wanted to ask about the criteria that the organization believes would be safe to return to campus. Is there a threshold or a daily percent positive over a sustained 14-day period? When would y'all make the decision to return to campus? But also I wanted to know that campuses aren't just like opening with like everything's normal. Obviously there are cleaning protocols. There's a lot of measures that are being taken. Are you saying that that's just not enough and it's just not smart right now?
Well, there are about a third of our institutions that are opening up more than 50% of classes to face-to-face, and another third that are opening more than 20%. And that's just hundreds of thousands of students being exposed and their faculty members being exposed. We put together a task force that came out with our recommendations for how to safely reopen back in May, and you can find those on our website. There's a 13-page document there. There's a link, Joe, sorry. And so we think we're beyond that. We think we've asked for it to be done safely, and too many of our schools are not making plans that we consider fully safe. And with the resurgence, the situation is not right to go back into crowded classrooms and then have those students go out and be in community contact. That's just asking for community contact. There's a lot of problems with some institutions' plans for tracking and tracing. There's a lot of problems, even with some of the social distancing measures that are lacking. So because there are 40 institutions of higher education, they've all been required to come up with their own plans. There's so much disuniformity, that it's hard to make a sweeping statement on that. But because there are too many common shortcomings, we feel that we cannot ask to open for the fall. And the fall would give time for us to have, flatten that curve again, get those numbers down again, continue on with the learning that we can do through remote learning, and then hopefully we'll be in a good enough situation that we can pick up full capacity in the spring.
And a quick follow-up, do you have a measure, like a threshold that you would want to see that y'all would be comfortable opening up in the spring?
Well, there have been several recommendations and they keep changing from CDC and from the Florida Department of Health, but I don't think we've met any of those metrics either. And so it seems ridiculous if you're going to ignore your own public health officials, even as they're loosening those constraints, that's not good enough. And so rather than us make up a number, if people could at least adhere to the numbers they're already given, even if those numbers are being weakened.
Hey, the lightning strike cut me off the line here, but I have Anna Cevallos with her hand up. Anna?
Hi, yes, it's Anna Cevallos with the NISERS of Florida. I was actually going to ask about some of the measures that you thought were shortcomings of the plans that were implemented, but you sort of answered that already. But as a follow-up on that, though, you mentioned that there's a few institutions that have not implemented contact tracing or a plan for how to quarantine students and faculty. And what I'm wondering is, what do you think at the state level, right? Why are those measures not being implemented? Is it a lack of funding? Is it just a plan that was just maybe implement or put together a little bit too early for the current condition? Or why do you think these measures are not being offered for the fall?
Yeah, what we saw happen was that sort of the word came down from the federal government to the state government, and from the state government into the educational system and the leadership within the administration and the governor's appointees. It was consult your public health officials, make your own plan, and rely on personal responsibility. And when we had very few cases in Florida, we might have gotten away with that. The problem is those plans were created very early when we were in a pretty good situation. And we have over 61% of the schools that we represent have not altered their plan at all since July 1. And so that's just not acceptable. Now you're already on too short of a turnaround to get it done better by the time we need to be opening. And so not addressing the reality on the ground is the biggest problem that we feel we're facing. And a lot of that was pie in the sky, it'll all be okay, it'll all work out, fingers crossed, because for a while we looked pretty good in Florida, but we don't now. And so mid-March, we were in a pretty good situation, and we shut everything down in order to keep our campuses from being super spreader sites. And that's what we're asking. We're asking to do that again, but for the whole semester, so everybody knows what the fall semester is going to look like. Not change it halfway through or change it in a month when there is an outbreak on a campus. That's disturbing not only to the faculty, but especially to the students in their lives, especially if you're sending students home from residence halls, you're sending them home to a situation where they may not have prepared to be online. Those kinds of situations happened in the spring, and we don't want to see them happen in the fall. And so the idea is to go ahead and prepare to announce we're going to be online. Everybody get on the same page, get prepared. Let's do this semester to the best we can through remote learning. And then we'll see where we are when we're looking at the spring semester.
And as a follow-up, sorry, has this been communicated to at the administrative level of some of these institutions, and what has their response been? Have they said, no way, we're reopening anyway?
So here's the thing. We, in May, early June, we had our task force, and we shared those recommendations with administrators so that they could make sure they were addressing all of the concerns. Some of them did invite faculty and union leadership into those conversations, and I think and took their time, and those are some of the better plans. Some of the ones who put out very skeletal, brief frameworks of plans early and have not revised them are not addressing the reality on the ground. And so there's a lot of room for improvement. And since there seems to be no impetus to revise and improve those plans, it doesn't look like we're going to be able to reopen safely.
Thank you.
In many places. I will say there are some schools who are doing a very good job, and there are some schools who are revising. But if 61% of the schools that we represent have not even undertaken to revise their plans since July 1, that's not a good sign.
Question is from Adrian.
Marshall, that's not press, so we're not taking that question.
Oh, okay. Okay, sorry about that.
Joe does have another question. Joe McLean.
Go ahead.
Yes, Joe McLean, WJXT again. I wanted to ask. So you're calling on the governor to say go 100% online for the university system, are there any other I guess requests, recommendations, demands that have, or is that really just the main one?
Well, this is what we're talking about today, but if you go to our reopening plan from our task force, there are a lot of asks in there. There's mental health support for our students because of increased anxiety and the uncertainty that they're facing. There are academic success measures as far as extra tutoring and extra support. There are calls to what do you do with a student when one of their classmates tests positive and has gone to 4 classes that week? Are all those classes now quarantined? Are all those professors now quarantined? What happens to those professors' students in the other classes, right? And so there's too many who have not, almost 90% of the schools have not made any provision for that kind of coverage. And so what happens when people start getting sick? Even if it's small outbreaks, but if you have a big one, you're going to be shutting full campuses down again. You're going to be trying to send students home. We did that in the spring. It was not pretty. It was not good. It was very disruptive to our students' academic process. It was very disrupting just from a psychological point of view for everyone. And so we're asking that we go ahead and set the floor, say, this is where we are. This is how we're going to do it safely for this semester. And everybody knows what to expect instead of having the rug pulled out from under them mid-semester again, depending on which campus they're on.
Next question we have is from the Tampa Bay Times, Divya Kumar.
Hi, good afternoon. Thank you. I was wondering which campuses have been revising their plans, and do you feel they're effective revisions?
Again, there's 40 institutions of higher education in Florida, and that question is so broad that it's hard to give a specific answer. We do have some information where we've looked at and asked specific questions like masks and things like that, and course coverage. We do have those answers that we could make available to folks if they want to follow up that particular path. We can tell you which schools have done it better. I don't have them all memorized because, like I said, we represent 28 of the 40 schools, and everyone's doing different plans. And so some are right on some things and some are others. But we can talk to you about details if you have particular schools in mind, or if you just want us to tell you which schools are doing it the best or which are doing it the worst. We can absolutely provide that to you.
Thank you.
I don't see any more. Were there some on the chat, Lauren?
No, there weren't any specific questions from the press or from the general public. Any other press on the call, press conference live here that would like to speak?
Lauren, while we're waiting to see if anybody pops up, I would advise everybody who's interested in following up on this, if you would go to our union's website, unitedfacultyofflorida.org. There is a link to the PDF of the higher ed reopening task force that we chaired and brought in stakeholders to ask all the questions and take on all the different angles. Part of that does include student success. It includes workplace protections. It includes how to pay for things. And particularly one of the things that hasn't been mentioned is how to close that digital divide of the students, especially in the college system, who do not have access to broadband internet, do not have access to a computer or a tablet they can work from on home. And so we're asking for the administration on up to the governor to help us close that divide so that all of Florida's students can have an equitable access to the quality education that we provide here in Florida. So I want to thank everybody for their time. Lauren, was there anybody jumped in while I was saying that?
No.
Okay.
Any last call to press?
Yeah.
Last call to press.
Let me just say,
go ahead, Marshall, but introduce yourself.
I'm Marshall Ogletree, the Executive Director. For the presser that I know that were on the line that I had the invitations for as of a few minutes before the meeting, I've just sent you the letter we sent to Governor DeSantis. A similar letter was sent to Commissioner Corcoran, Chancellor Kreiser, and the FCS Chancellor Kathy Hebda. So those letters are going out as this call ends, but you got a copy of the one we sent to the governor. Should have it now, if you had signed up earlier, that is. But we'll try to get that out to others after this meeting.
So we will make those letters available to everyone.
Marshall, I see Anna's hand raises again, and Jamina Tavel in the chat asked, his mic is not working. I know UFF is not suing at the moment, but is it planning to escalate? Also, have they heard at all from the state in regards to this?
No, today is sort of the first point of discussion on this, where we're calling for a statewide directive to move to remote learning for the fall. So this would sort of be the first step in this process. So yes, we will be continuing to call for this, to talk about this, to push out more information. Local leaders will be working with their institutions and their community partners on this issue. So yeah, this is sort of step one on this. We tried to help with the how to reopen safely. We feel we're beyond that, and this is the new direction that we're going to be taking. So we will be happy to provide anybody any information that they need, any kind of data, any sources of any of the data. We'd be happy to help you with that, and also copies of the letters that are going out. So this will be continuing through the next month or so.
Yeah, we have one more from Anna from the USA Today Network. Anna?
Anna?
Hi, sorry, again. I had two questions, and maybe hopefully you have this information. I don't know if you conducted surveys on this. I know that through the K-12 system, the FEA has conducted surveys of teachers, and I'm wondering if UFF has surveyed its members regarding, whether they feel comfortable. If they don't feel comfortable going back to school in the fall, what they would do. A lot of the K-12 teachers were saying that they might reconsider a second career because they don't want to put themselves at risk. I'm wondering if that's also a concern that you're hearing. And as a follow-up, if you've done any surveys, whether any faculty or any members have tested positive since the pandemic started.
So I don't have any of the private health information on anybody at my fingertips. I will say we have taken several polls or surveys as we've gone through. Mostly we've been relying on our local leaderships to give us feedback from their members, what they're hearing on the ground. But as academics—
Yeah, there was a, oh, sorry, Karen, there was a survey at UF, if Paul wanted to speak to that.
Yeah, the UFF did do one. Paul, do you want to? Is Paul still on?
Yes. So we basically we have surveyed faculty at the University of Florida, and we have overwhelming testimony where faculty and staff and members of the community, and I think we have to remember we're all of the above, right? We teach on campus, but we're also members of local communities. There's overwhelming concern about the spike in infections, the question of reopening, but also the question of, again, the impact that having so many students return to many smaller college towns is going to have on infection rates. And also addressing the question earlier, a lot of our kind of middle-aged and older faculty, frankly, are terrified of reopening. Parents are terrified. Faculty and staff who have elder care responsibilities, and many of us do have elder care responsibilities, are terrified. And so I just got 2 messages late last night, in fact, from emeritus faculty who live close to campus, who are writing really, who wrote me really not on behalf of themselves, but on behalf of members of the Gainesville community, expressing really severe concern about what campus reopening is going to mean to our local community.
Let me just add a statewide picture to that. We're academicians, we're evidence and data driven rather than feeling driven. And so our members are very aware that our population of instructional faculty are older than average population. And so we have more members in at-risk categories just for age as well as other underlying health issues. We know what the numbers look like. We know what the trajectory has looked like. And so those fears that Paul expressed, those are not just random fears. Those are based on what we're actually seeing, the data we're actually getting. And the same thing with polling folks. We know they're concerned because they're looking at the same data we are. And so it's not even a question about how we feel about it. It's a question of what is actually numerically safe, and we're not there yet.
And I'll just add that at Florida Atlantic University, we also are surveying and polling our faculty as well and our members. And today is the last day, but some of the numbers we've seen overwhelmingly support remote, fully remote in the fall, and a concern for the health and safety of our members.
And one last thing, this decision was not sort of a top-down decision. This concern was brought up through our local chapters by membership, and they're the ones who are driving us in this direction. And so we're just voicing the statewide concerns that people have. So this isn't just us making a decision. We had a lot of discussions. We looked at a lot of data. We have had some surveys. We've had a lot of anecdotal discussions with people, and a lot of our chapters have had town halls where people are airing these concerns. And so this did not happen in a vacuum. This did not happen just willy-nilly. That did not happen just because of what's going on with K through 12. This is driven by our actual concern for not only our members, but for our students in our communities.
Thank you.
Thanks, Anna. Lauren, is there anyone else?
No, it looks like that's it. This is last call for any press questions. Going once, going twice.
And we're also displaying contact information for today's incredible speakers. Thank you so much. And Jafar will paste this into the chat, or maybe Lauren is, but we will get you that info if you have direct questions that you weren't able to get to.
So, pardon me, in the chat, I have attached a Word document with everybody's contact information in the order that we spoke this afternoon. And we will send out the full video for those that were not able to record to the press as well.
So I want to thank everybody for attending today. Please reach out to us if we can help in any way with any follow-up questions. If you want to speak to any of the local leaders, if you're a regional media outlet, we can put you in contact with them if you have any trouble finding them. I appreciate everyone being on the call. I appreciate all of our members who joined us on the call. Thank you for your work. Thank you for helping us message this and get this out. You know, we can't do this on our own. We need to have the students and the communities with us on this. And so it's up to us to explain what we're asking for and why. And so please take what you've learned today and go talk to your friends, your members, your family members, your community members, and let's make sure we all have a system in Florida that's safe for everyone to continue to improve their lives through higher education. I thank you all. Have a good day.
Thank you.
Thank you. Thank you so much, everyone.
Thank you.
Thank you.